Hello and welcome to the very first episode of 𝗗𝗲𝗞𝗜𝗘's newest series, Talkie. I'm Jobert Salazar.
And I'm 𝗗𝗢𝗞𝗘𝗘.
And we're your best hosts for this series. So in this podcast series, we're taking on the Philippines' hottest health topics in line with the Department of Health's monthly health calendar. So to help us with this, we are featuring our esteemed medical experts from 𝗗𝗲𝗞𝗜𝗘 to give their insights and perspectives into their respective fields.
Today, we are joined by our fellow Alphan sisters, Dr. Salazar and Dr. Sara Sungahid, as we dive into the various aspects of lung health, discuss common lung issues, and as well share tips on how we manage healthy lungs. So thank you so much, docs, for gracing us with your presence despite your busy schedules.
Thank you so much, docs, for being here. And how are you guys feeling, Mandok?
We're feeling great. We're excited. This is for your first episode for this podcast.
Yeah.
We're also very excited to ask you these questions, Doc, because we're also very curious.
We're curious.
Thanks for inviting us.
Yes.
We're ready for your questions.
So to start off, Doc, could you give us a brief overview of how the lungs work and why they're so crucial to our health?
The lungs are essential organs in the body. They remove carbon dioxide from the blood and it transport oxygen. So these are vital functions that maintain adequate oxygenation throughout the entire body.
So, Doc, can you tell us what are the common signs that tells us that our lungs are not functioning properly anymore?
Okay, so some signs that you should know when something is wrong with your lungs is coughing. When you cough, when you're out of breath, when you hear wheezing. Wheezing is like hissing sounds, like wee, wee. Okay. That's like a pig, wee. Okay. Other signs are if like instead of being able to do your normal activities in a day, like walking, instead of like walking 50 meters and you feel nothing, then you find out another day that you can only just walk around 25 meters. So that's being out of breath for your usual activities. So those are signs and symptoms that you may find if you have something wrong with your lungs.
So, in relation to that question, Doc, since there's already an increase in the use of vaping, so what are your thoughts, prayers, Doc, in cases of this, Doc?
Okay, so unfortunately, e-cigarette or vaping has been increasing rampantly nowadays. So in 2019, the Global Youth Tobacco Survey have reported that 1 in 7 school children aged 13 to 15 years old have been using e-cigarettes or vapes. So around 37.1% of them have open access to vape. So this is disappointing, very disappointing news, because as we all know, cigarette itself and also vape have harmful chemicals or toxins, right, Dr. Sara? Around 7,000 of them. We can't name them all.
Yeah.
And it can cause harmful effects to our body, so such as, again, those symptoms mentioned earlier, the shortness of breath, persistent coughing, and also sometimes wheezing. So these cigarette or also vape, they also contain harmful substances such as formaldehyde and also carcinogens.
Oh, Doc, no, it's very alarming na. They started as young as 13, no, to 17 years old. And I also noticed, Doc, that especially in today's culture and generation, Doc, the use of vaping, it's falsely advertised as a safer alternative, Doc. So, very scary pa siya, Doc.
Because there's so much colors, there's so much flavors already, Doc. And then you can see them everywhere in the store, son. So, Docs, can I ask you the age-old question? So, is it safer to smoke cigarettes or e-cigarettes, or commonly known as vapes, Doc?
Okay. So I'd like to answer first. Neither of them is safe. So neither cigarette nor vape. So neither is safe. I have a strong stand against that.
No daw.
Yeah. How about you, Dr. Sara?
I agree, definitely with you. Neither of them are safe. Both of them are harmful. So there has been studies going on that say that vaping is an alternative device for smokers, okay? Now, it may be true that there are lesser chemicals inside your vape, against the smoking cigarettes that has around 7,000 toxins, okay? But it doesn't mean that your vape does not have any toxins. It has toxins, it still has nicotine, it has still your formaldehyde. I can't put vape as just one device. Vape or e-cigarettes are different devices. Each of them maybe have different formulations. Some have nicotine, some don't have nicotine, but still the idea of inhaling these substances into your lungs is still the same as smoking. So it still does the same harm as to your lungs. But we still have to gather the data since e-cigarettes or your vapes are just new. Tobacco and cigarettes already have data since it's been almost more than a decade or more than few decades that we have these things that we're using. While e-cigarettes, we're still gathering the data. There are no facts yet of the long-term effects, but we don't have to wait 20 years and see you in our clinics because we told you today that it's harmful, and then you come into our clinic after 20 years. So I won't tell you that we told you, right?
So again, guys, neither are safe, okay? So don't smoke. Don't smoke. Okay.
Don't smoke, don't vape.
Yes, don't smoke, don't
Amen.
vape. So in relation to that talk, I'm also curious, or we're curious about the current state of lung health. So have you ever encountered any cases, Doc, which pertain to the complications of using vape?
Okay. So personally, in my clinic, I have not encountered yet a patient who has been smoking vape with symptoms such as cough, shortness of breath, or wheezing. Personally, I don't have a patient who has a case like that right now. But I think there was a case in the Philippines that it reported a 22-year-old male.
I think we talked about that before. So it was a 22-year-old male here in the Philippines just this year. It was around May. So that 22-year-old young person was hospitalized and that he really died from myocardial infarction, or otherwise known as your heart attack, okay? That young person had no history of hypertension, diabetes. He was not hospitalized before. But then here he comes into the hospital with chest pain and died of a heart attack. The only pertinent thing in his history was that he has been vaping every day for 2 years. So that's the only thing in his history that we can attribute to his current condition and to his death. So just 2 years, and then it affects already his heart. When we talk about vaping, we associate it with your lungs. But we must not forget that smoking and vaping, these harmful chemicals in these devices, does not just affect your lungs. It does primarily, of course, but this is multisystemic. It affects your heart, your brain, your lungs, the blood vessels in your body, which then causes these diseases such as your heart attack.
Wow, very alarming, Doc, no? That it happened within the span of 2 years. Then it started as a lung problem, but then it affected other systems as well. So
For that, Doc, could you say that the vape is much worse than the cigarette, since it only took 2 years for that patient to already have the symptoms and at the end heart attack? Because usually, like in cigarette smokers, they usually take longer to have the symptoms and like more chronic smoking compared to the 2 years of the vapor.
So I think for that certain patient, he has experienced or suffered the consequences of vape because he might not have checked properly the amount of nicotine, or maybe the source of where he bought that vape. Maybe it's not like, what do you call that, regulated or approved by our government or DTI, Department of Trade and Industry. So maybe those kind of vape that this 22-year-old has acquired, maybe it has additional harmful substances that has led to his demise, aside from nicotine.
In relation to that, Doc, is there anything that Cebu or the Philippines has been doing to help regulate vapes?
I think for the national level, the Philippines, there's RA 11900, which actually regulates the purchasing of the e-commerce or online purchase of your vape or your e-cigarettes. So it regulates it to those 18 years old below, they can't purchase that. I think in Cebu, we have our own local ordinance.
Yeah, we have our own ordinance here in Cebu, which does not allow 21 years old or younger to purchase vape or cigarette. And unfortunately, smoking cigarettes is also not allowed in public, but it has not been implemented strictly.
Yes, Doc. I can still see them vaping, Doc, even in public spaces. So for that, Doc, do you have any advice, especially for those who plan to quit smoking or vaping, Doc?
So for these smokers, current smokers who plan to quit, there are 5 major steps. So this is the ask, advise, assess, assist, and arrange. So Dr. Sara, which of the 5 steps do you think is the hardest?
Oh, thank you for that question.
I'm the host
So,
now.
I think it's always the first step that's the hardest. The first step is ask. It's just a simple question, right? Do you smoke? Now, you may say it's just easy to answer, yes. But you know, most of our patients, they would deny that they smoke, or some of them would accept that they smoke, but they would just say, usa raman ka sigarilyo sa usa ka semana, doc. But then their wife comes in and say, unsay usa ka sigarilyo, usa ka pakiti sa usa ka adlaw. So they actually just minimize the number of sticks that they smoke, and instead of 1 pack, they say it's just 1 stick per day. So the first step, ask, is very difficult. Another step that I would like to emphasize is the third step, assess. So assess means when you ask them, sir, are you ready to stop smoking? So that's the very most crucial step, because they don't come back to the clinics because they really cannot quit smoking.
In your personal experience, docs, do they really continue to stop, Jid? Like the ones who go to you and say like, yes, I'm ready to stop na, Jid. Do they actually stop afterwards?
I think one of the factors that can actually push them to really stop smoking is when they already have symptoms, such as shortness of breath or blood in their phlegm. Some of them might be afraid and already decide right away to stop smoking.
So you had a patient, Ray, right?
Yeah, I had a patient in my clinic when he came in due to blood in his phlegm just a few days ago. And then I haven't asked yet the question, sir, are you ready to quit smoking? He already said right away that, Doc, dili na ko manigarilyo, Doc. Mundang na gyud ko, Doc. Oh.
So these things, when they start to show symptoms like blood in their sputum, once in their physical exam, just because of work, they had to get an x-ray, and then you find there's a lung mass, or when they get diagnosed with lung cancer, that's actually the biggest trigger or like changing point in their lives when they say, I want to stop smoking.
In relation to that, Doc, were there also cases where there's secondhand smoking from vaping, Doc?
For my personal patients, as of now, not yet with vaping, but the evidence with secondhand smoking with tobacco or cigarettes, it really does exist. I don't think it's very different from secondhand smoking with vaping, since there's still chemicals in the air that still get to be transported to your other material things or to people beside you. So no cases yet, but I still think it still applies with vaping.
So Doc, what can we tell our viewers? How do we maintain healthy lungs?
First is do not smoke. Don't ever try to smoke cigarette or even vape. And then aside from that, maintain a healthy lifestyle, eat a balanced diet, and then do daily exercise.
So what I can add to that, we really want to emphasize, stop smoking or vaping. And if you don't smoke or vape, don't smoke and vape, okay? So you have to listen to us, your doctors.
Yes.
We don't want you to be sick. So we want patients to come in and tell us that they're feeling great, they don't have any illnesses. It's not just for our patients. We treat our patients like their family. I don't want my father, my mother, my nieces to be coming home and having cough, having difficulty of breathing because they themselves were vaping or they were exposed to someone who were vaping, okay? You may listen to us, your doctors. If you prefer not to listen to your medical practitioners, listen to your mom, listen to your wife, listen even to yourself. You know what is right. You know that smoking, vaping is never good for your health. It is always harmful. There are no good benefits you get from it. So I think that's my advice.
Yes, so basically, listen to your gut, or in this case, your lungs.
Amen.
So, do you have any advice, docs, for those with existing lung conditions already?
So basically, these patients, we diagnosed these patients with chronic obstructive pulmonary disease because aside from chronic smoking, symptoms usually appear 50 years old or above. So for these patients, we advise them still the same, quit smoking, do your best to stop smoking, and also we can also manage them with additional like inhalers to assist their shortness of breath or difficulty in breathing. And then also aside from that, we advise them for vaccination against flu, pneumonia, and respiratory syncytial virus to prevent them from acquiring severe cases of lung infections, because you see these patients already have weak lungs, so they have a more propensity or tendency to acquire the severe cases of microorganisms. And then also we can enroll them to pulmonary rehabilitation programs. So these kinds of programs, they can assist their breathing, because most of them already have thin muscular mass. So with pulmonary rehabilitation, they can exercise the necessary muscles to assist their breathing.
During these rehabs, Doc, how long does it usually take for the patient to start feeling better na? Like, does it take like another 5 years like that?
Well, these pulmonary rehabilitation programs, as soon as I think maybe in a month or 3 months, some of them can already benefit from the exercise programs. So some of them can experience improvement, even mild improvement from their breathing, because usually these programs have 6 to 8 sessions, right?
Yeah. We have a patient in our hospital after her 8th session. So before, she was only able to stand up, take like 4 steps. Now after those 8 sessions, she's able to walk by herself around 25 to 50 meters. So it may be small for us who have no breathing problems, but for those people who would desire to be able to move by themselves because they have difficulty in breathing, that's a very big improvement.
Could they be fully cured, Doc? Like, you could say na they're really the same way as a normal person with healthy lungs?
Unfortunately, no.
Ooh.
You mean for COPD patients,
Yes,
right?
Doc.
No, because the disease is already chronic and progressive, right?
Yeah.
But we can control the symptoms.
Cure may be a strong word, but
Yeah.
what we want is treatment. For them to live a life that has quality. For them not to depend on person to everything they do. So they can still walk to the bathroom, they can still change their clothes, they can still actually just work. So what we want to provide is improvement of the quality of their life. So cure, maybe you would think about, in the Philippines, maybe not a lot of cases for lung transplant, such as those things, but let's be realistic. It's more of treatment and improved quality of life.
Yes, doc. So you heard it here, guys. Vaping is not good. So think twice before you start vaping. So thank you so much. Really though, thank you so much, docs, for sharing your expertise with us today. Very informative. I learned a lot, and I'm sure our viewers have learned a lot as well.
So thank you so much to our viewers for listening and tuning in to our very first episode of Talkie. And remember, at the end of the day, it's your lungs and the air we share. So see you next, guys. See you next, guys. Sorry. So see you next. So thanks to all our listeners for tuning in and joining us for our very first episode in Talkie. And remember, at the end of the day, it's your lungs and the air that we share. So see you next time, guys. And as always, Alpha Music Mafi.
Proud to be.
we'd like to thank our sponsors for this episode, Dr. Coffee.
I like the way you kiss me. I can tell you miss me.